So welcome to the opening session for access21. I am thrilled to welcome our two speakers today, Simrat Sandhu and Eric Axter. Thank you both for being here. Before we get started with those hard questions that we're going to review today, let's learn a little bit about you both. Simrat, maybe you could start.
Thank you and good morning to everyone. I am new to Vizient, come from Cleveland Clinic, where in my last role, I served as the Chief Supply Chain and Support Services Officer, served in the provider market for 15 years, and prior to that was in industry working for a few of your peers. And it's been an adventure, and I find myself at Vizient today helping look at the same challenges I did as a provider in cost, quality, and market performance, and having a chance to now solve them for our providers and other members. So really delighted to be here and looking forward to the journey.
Great, and welcome. Very excited to have you here as well. And Eric, by my count, this is your third Access appearance, which I think that puts you in the top 10. Could you explain your audience and your role for us?
Sure, yeah, thrilled to be back, Justin, for the fourth one. So I got a good batting average here. I oversee our entire PPI clinical preference program, everything from the GPO and the supplier relationships and contracting to aptitude in our technology, as well as our service line consulting team. So end-to-end medical device.
Excellent, great, and thank you both. For I think that the context, for the audience really, Simrat, I'd love to hear you maybe elaborate on some of your recent interactions with members and suppliers, and maybe how that experience has helped shape this new strategy that we're evolving.
Absolutely. So continuing on to my previous introduction, I should have added that as part of my new responsibility at Vizient, I'm overseeing the strategic transformation of Vizient as it evolves itself into a services-led analytics-enabled offering, helping members and suppliers solve challenges across cost, quality, and market performance. And in addition to that responsibility, I help oversee our supply chain businesses, part of which are the med device business that Eric Axter just alluded to. Coming to the Vizient family and having a chance now to have interacted with a number of you, providers and suppliers, early observations help validate my own experiences as a provider. Our ability to curb healthcare costs is more valuable than ever before. The capabilities that Vizient brings in terms of providing insights, data, expertise to help members streamline and transform their own healthcare operations is of paramount importance today. As we specifically to supply chain, as we talk to our members, what we're beginning to hear is while best price and fair price is very important, meaningful use, managing variation, and maximize the impact of every dollar spent in healthcare is even more important. And as we're all experiencing the larger transformation of care, the growth to alternate cares of site, the ability to serve patients where their needs are, we are going to have to find a way to create more and more transparency and partnership across communities, across our suppliers and our providers to help solve these challenges. But our providers and suppliers are speaking loudly. They want a chance to partner. They want a chance to participate in this larger transformation. And they need more data, more insights, more interchange of ideas across each other. And we find ourselves in a unique position to help with this.
Excellent. That's really good to hear. Very, very interesting. And I know we've talked about kind of this idea of category management and aptitude kind of playing that role. So, maybe just based on your comments there, can certainly see how this would play in that PPI space. Eric, it's considered to be highly customizable and probably needed some consistency or best practices. So Eric, how do you see this kind of strategy being applied in that area?
Well, I think the vision that Simrat has outlined is perfect, and we're exquisitely connecting to that in the PPI space. And the unique challenges of the physician preference, clinical preference, as you alluded to, Justin, it's really dominated by local decision making and local complexities that we need to be able to adapt to and flex to as Vizient and figure out how we can appropriately scale our capabilities at a national level to the local environment. So we are thinking about how we can serve as that convener from a data and technology and visibility perspective on behalf of our member organizations. So for example, thinking about making informed decisions around having access to that data at your fingertips, around the technology that enables a much more dynamic relationship between provider and supplier and can be monitored and leveraged to continue to drive performance improvement from the contracting or sourcing event to be able to then engage thinking around variation, around utilization, around enabling value analysis, and inevitably about total cost of care. So we're really structuring our strategy to be able to pull together and synthesize those data elements, the supplier capability and role in cost management to best inform and support our providers on their cost management and clinical performance journey.
Simran, I was wondering if you could maybe elaborate on this idea of the ecosystem and especially let's call it the clinical dynamic. You've obviously have a history of success engaging in physicians, some of those clinical stakeholders. Could you maybe speak to what put you in a good position to have those discussions, or what methods did you use to help you become successful?
Eric's really been on point here, talking about how the currency of change in healthcare is data and evidence. My lifetime experience, physicians, healthcare systems are data-driven entities. They make evidence-based decisions and realize that patient care is about making the best decision, the best investment of dollars that you can to create the best outcomes for caregivers and patients. And all this can only happen if we have at our fingertips data and evidence and insights that fuel actions. So specifically, my personal journey taught me that supply chain is a very interesting discipline that's subspecialized by spend category type. Most of us are familiar with the med-surg categories and the idea of concepts such as just-in-time, getting product where it's needed at the right time, managing for quality, managing for variation. But as we start getting to some very, very service line specific spend areas like PPI or indirect spend areas like purchase services, the need for data diversifies. We need to start connecting supply performance to clinical performance in a more meaningful fashion. Physicians, as they look to make decisions, don't just want data about costs. They want to understand quality and performance of products and services in use. They want to understand the efficacy and value that is provided by these products for outcomes. They begin to understand that the data is not just meaningful in inpatient settings. We need to follow the patients home to understand how they fared post-surgery. And this migration of our understanding that data is important from a event perspective, but even more interesting from a patient journey perspective, became really meaningful in my idea of studying supply costs, specifically in the area of PPI. And the ecosystem that probably enabled me to have conversations with physicians that led to meaningful change were ecosystems of data that created a connectivity between cost, quality, and performance of those products, tied to the patient care that was provided, tied to the outcomes that came from those products and services. And we began to realize that the more transparency that is provided to physicians, the better decisions they're equipped to make. It's not a journey of trying to force compliance or commitment on particular product categories. It's a journey of making the right decisions for patient care, ensuring that we sustain and maintain healthcare performance and fuel better performance while making care affordable for all. And once that conversation changes from just about that product to a conversation about patient care and doing the right thing for the patients, for the community, for healthcare affordability, for migration of care, we find that physicians make the right decisions. The lens changes. These aren't refrigerators or cars that are being bought as commodities. These are these products are intrinsically part of that care delivery model, and beginning to understand value and stating that value and understanding decision-making from that 360-degree perspective is key to engaging physicians in decision-making. What we have a chance here today is to build the data and ecosystem of insights for all physicians, for all administrators that we believe are looking to make the right decisions, but lack transparency to such data to fuel insights and decision-making.
That's great. And I think, Eric, that's a great segue, because we've talked about this clinical supply chain alignment and kind of the importance of data. So how are we addressing that from a data standpoint? What types of insights are we trying to deliver or even pair together?
Great question, Justin. And I'm smiling because I'm thrilled to follow Simrit. I really liked her comments there. And it's a perfect launching point as we're thinking about data and our medical device clinical preference strategy. So as I think about it, or as we think about it, Aptitude is the perfect launch point for us. We've been very focused and very deliberate around bringing suppliers and providers together to solve problems, solve inefficiency, solve cost and utilization and clinical performance opportunities together. Aptitude, with its dynamic platform and data and insight capability that it serves up, really gets us deep into the cost management and that linkage between supplier and provider. There has been a press release recently, and we've really heavily leaned into this from a Vizient PPI standpoint around Surgery Exchange and our enhanced partnership with Surgery Exchange. The thesis there and the opportunity for us is it gives us a completely new portal into visibility around case scheduling data, inventory data, and really that entire supply operations process to support a bill-only procedure. That is a very critical data connection point that we are going to be integrating with our Aptitude capabilities, and it gives us a much more forward-looking view as to what's coming down the pike in terms of cases, in terms of inventory that's necessary, in terms of sterilization and the instrumentation, and what prostheses and devices are being used. Follow that post-procedure. Vizient has great capabilities like procedural analytics and like CDB. So we're now able to think about outcomes around case variation, around supply cost variation, around care pathways. So hopefully that's coming together in terms of our end-to-end life cycle view with data and insights as the foundation. And then the beauty of Aptitude is that it gives us a framework to be able to partner with IDNs to look at all of their sites of care and leverage the technology to apply to the uniqueness and the locale of the procedure and the specific data and operational requirements as they look across their IDN landscape. So we're very well positioned and really excited about Surgery Exchange. There may be more to come as we think about building out our entire ecosystem capability. But the driving force in to build on what Simrit said is really around transparency and visibility and driving enhanced performance by bringing these capabilities together. And Vizient will serve as that market convener. And we're looking at this really as a supplier and provider partnership, with Vizient being able to enhance our role in facilitating that.
Eric, as you were talking about that example, I was smiling as an ex-provider, because what you nailed in that example is that the supply chain of medical device has unique attributes and needs that drive value for providers, for suppliers, for administrators. Your example around the fact that our physicians need to see service line views of the data to be able to understand performance of their products and other decision-making across the continuum of care was key to showing how we can evolve to create that transparency. Another great value driver that was drawn out in that example was the cost of inventory and sterilization in devices. The supply chain beyond the OR, the perioperative supply chain, the post-surgery supply chain of follow-up, and an inability at times to be able to connect all the data points that could lead to better efficiency of how these types of products are either brought into healthcare settings or taken care of post-surgery from a recall perspective, from a tracking perspective, from a quality assurance perspective. The opportunity ahead is one that truly allows us to improve performance for suppliers and providers. We've talked about cost and quality a lot, but the opportunity to trim the inefficiencies, to reduce the waste, to truly bridge the gap that's been created across the suppliers and providers by the opaqueness that exists, and the waste that's sucked into that darkness can be eliminated. It's a visual because having lived it, we all realize how dark that space is between production to consumption in healthcare.
Well said.
Yeah, I think that the term data has just evolved. There's so many things now that are trackable, traceable, and the ability to pull all that together. I think that's unique. I believe that's what you guys are hitting on. Eric, while we have you here, we talked about category management, the idea of aptitude as a category management. It's a unique branding opportunity, in the market, and almost a way for us to really go out and define a unique approach. How do you see that rolling out? How do you see that impacting?
Well, what I see, Justin, and what I think about with aptitude is a couple key words: transparency, visibility, and frankly, partnership between supplier and provider. So the opportunity to build the aptitude brand around those key fundamentals, and leveraging Vizient's sweet spot within that of data, of insights, of subject matter expertise, and the technology delivery. Hopefully the audience here has a chance to see the vision that Simrit has outlined on behalf of Vizient, that we're implementing on behalf of medical device, and really the intersection through aptitude and leaning in to that transparency, visibility, and automation that creates informed decisions, that creates opportunities for efficiency, that brings together a much broader narrative, so we understand inputs, outputs, and how data can work together to inform better performance. And that's really, in my mind, the opportunity and the direction we're going to be taking the aptitude brand.
A quick summary, your view. What's important for providers and suppliers to take away from the discussion that we just had, or given this new direction? What's the one thing you'd like to emphasize as a takeaway? Maybe Simrit, you could focus a bit on the provider side, and maybe Eric, you could focus a bit on the supplier side.
One key takeaway that we all agree on is rising healthcare costs are unsustainable. Consumerism of healthcare and hospital to home, the migration of care to where the patient wants it is here to stay. And as we begin to figure out the challenges and solve for better and more patient-centric care design, for lower cost healthcare, we believe that there's an opportunity for providers and suppliers to truly partner, to look at this 40% of the expense base of health systems tied up in non-labor expenses, including medical device, and ensure that we're acting as resource stewards of every dollar spent. And I believe that everybody that is participating on this call today is passionate about this and realizes there's an opportunity to be better stewards of healthcare spending and to make for better evidence-based decisions in the healthcare ecosystem that are made together, not made in isolation, not made by one party, but are made collectively for the betterment of patient care.
Well said, Simrit. Hard to follow that. I think what I'd add, Justin, from the supplier takeaway, at least near and dear to me, is that we want to partner with you. We want to change this dynamic and inefficiency together. We want to think creatively around how we contract, around how we think about value, around tackling SG&A together, really all with the intention of driving better performance back to our members, your customers, the provider. So it's really an opportunity of transforming the market, and we want to do that with you.
Thanks, Eric. It is such a pleasure to have done this talk with you. And I'm honored to serve the members of Vizient as well as our supplier community. Please understand, we will be making investments in all capabilities that lead to this visibility. You've seen us invest in aptitude and evolve it to create visibility, transparency, and value in the healthcare supply chain. We will continue to invest in tools and technologies that light up the PPI supply chain, the MedCert supply chain, the indirect spend supply chain. Our commitment to truly creating transparency and being the convener of value in this arena of spend management for healthcare providers is key to our mission, and we are doubling down on our capabilities and our investments in this space, and hopefully that came across today.
Thank you, Simrat. It was a pleasure, and thank you, Justin.
Yeah, you guys did great and very, very informative, and I know the audience really appreciates, and we appreciate the time, and thank you for participating in Access 21.
Thank you.
All right, we'll see you all at Access 22.
Hopefully in person.
That's right.
Yeah.
All right, I want to thank Simrat and Eric once again for playing the role of our opening session today. That's very informative and hopefully elaborates on the strategy of the organization as a whole. As we progress through our program today, we did want to give our staff an opportunity to contribute to the content and also your ability to hear directly from them about their interactions with customers and working with many of you out there. So throughout our program, you will see video snippets. So we're almost act as transitions through our different segments. So let's start with the first one here. Let's take a look.